Welcome to Health Code Blueprint. I'm so glad you're here. In today's session, we're walking through an advanced ICD 10cm audit case study that takes us from initial assessment to fully compliant coding. This presentation focuses on how multiple guidelines interact, especially when cardiovascular, renal, endocrine, mental health, and respiratory conditions overlap. Before we begin, here is our required disclosure. This video is for educational purposes only. It does not constitute legal, compliance, or billing advice. Always follow official ICD 10cm guidelines and your organization's policies. In this slide, we begin with the patient's presenting concerns. The provider notes document a follow-up visit where the patient reports a dry cough for 1 week. Chronic conditions are stable, the A1C is 7.2%, GFR has improved, medications are being taken as prescribed, and no edema is present. This information becomes part of our evidence layer, the foundation for validating every diagnosis code. Here, we review the physical exam findings. The patient appears well, with normal heart and lung sounds, a soft and non-tender abdomen, and no extremity abnormalities. These details help us confirm stability of chronic conditions and rule out acute complications. This slide shows the initial list of diagnosis codes selected based solely on diagnosis names. At first glance, these codes seem reasonable, but as coders, we know that ICD 10cm requires deeper analysis. Our job is to determine whether combination codes, hierarchy rules, or with guidelines apply. Here, we outline the structured audit workflow. First, list all potential diagnoses. Followed by reviewing guidelines for combination codes and sequencing. Then you can cross out any incorrect or subsumed codes. Finally, correct and finalize the compliant code set. This systematic approach ensures accuracy and defensibility. This slide introduces a key ICD 10cm rule. When hypertension, chronic kidney disease, and heart failure are documented together, ICD 10cm assumes a physiological relationship. This triggers the I13 series combination codes. Here, we apply the rule. Instead of coding hypertension, CKD, and heart failure separately, we use I13.0, hypertensive heart and chronic kidney disease with heart failure and stage 1 to 4 CKD. We then add the specific heart failure code and CKD stage code to complete the picture. This slide highlights the powerful, and often misunderstood, with guideline. Under the main term diabetes, ICD 10cm assumes a causal relationship with several conditions unless documentation states otherwise. This includes cataracts, CKD, neuropathy, and more. We apply the guideline to two conditions. Cataracts, because cataracts appear under, with, in the index, we code E11.36 along with the cataract code. Glaucoma suspect, not linked under, with, so it remains a separate condition. This distinction is essential for compliant coding. This slide explains an important exception. Even though diabetic CKD is listed under with, the provider explicitly attributes CKD to hypertension. Provider attribution always overrides assumed relationships. Therefore, we do not assign E11.22. Here, we apply recent coding clinic guidance. There is now an assumed causal relationship between dementia and mood disturbances. So instead of F03.90, we assign F03.93, dementia with mood disturbance, along with the separate code for major depressive disorder. This slide covers the respiratory hierarchy. When COPD and acute bronchitis occur together, the chronic condition absorbs the acute infection into a combination code, J44.0, COPD with acute lower respiratory infection. We still keep J20.9 to specify the type of infection. Here, we compare the initial code list with the audited, compliant version. You'll notice several codes were replaced with combination codes, and others were refined based on guideline application. This demonstrates how guideline-driven auditing transforms coding accuracy. We close with 4 essential principles. Follow the index. Triangulate combination codes for HTN, CKD, and heart failure. Verify attribution when documentation specifies a cause. Check hierarchy, especially in respiratory coding. These tools ensure consistent, defensible ICD 10cm coding. Thank you for watching and I'll see you in our next video.